All right, good morning everyone and welcome to our second webinar of today, Compassion, Use It or Lose It. So again, I know a lot of you joined our first session, but we do have a few new people that joined us this morning. So my name is Cathy Arsenault and I'm the practice consultant for ANBLPN, and I'm just going to be moderating the webinar for today. Before I introduce our speaker, I of course just want to take a moment to wish each and every one of you a very happy LPN Day. As we said in the first presentation, this past year and a half has been like no other, and we continue to be in the throes of this pandemic. So we at ANBLPN want to thank you all again for the competent, compassionate, and ethical care that you've been providing throughout the pandemic. There have been numerous challenges, fears, and stress. And you've all stood up and continued the fight against COVID-19 in a professional and knowledgeable manner. So again, we just want to say thank you. We cannot say it enough. So many of you may recall Susanne from our professionalism webinar series that we held a few months ago. Susanne is a well-respected colleague of ANBLPN, and she has collaborated with us on many projects over the years. I am once again very happy to be able to introduce and welcome Susanne again today as she presents this webinar. So Susanne is a registered nurse who's been practicing nursing for over 24 years. She attained her master's in nursing at UNB in the nurse practitioner thesis stream of the program. And Susanne has a varied background, having worked in acute care, regulation, and she's currently the on-track and standards coordinator for Horizon Health in Region 3. And of course, in her spare time, she continues to work on a casual basis in the NICU as well. So welcome, Susanne, and happy Nursing Week to you as well.
Thank you, Cathy, and happy LPN Day. So I'm not sure why the page here just moved on me, so I'm going to go backwards. Sorry. There we go. Earlier this spring, as Cathy alluded to, she and I did 2 presentations on professionalism, and during one of those, they brought up, would I be interested in speaking on LPN Day to you all? And I said, yes, on compassion, use it or lose it. And so it was just kind of an offhanded comment, but here we are, and I'm grateful to be here. You have probably heard before, I know I have numerous times, comments like nursing is an art and a science. Compassion, this is what I consider the art and the heart of the nursing care that we provide. And because compassion is the soft side of the profession of nursing, it is sometimes not considered as important, but the extra, the icing on the cake amongst our peers. And in stark contrast to this, when I was reviewing the literature for today, it shows repeatedly that the patients and their families, the public that we serve, still rates compassion as important in healthcare. And I was very happy to see, I follow this every year, that the profession of nursing is still ranked very high as a trustworthy profession, and we don't want to lose that. Therapeutic relationships are to be established on trust according to the assessed needs of the patients. And we are expected as healthcare professionals to set aside bias and prejudice and unfair judgment. And that's easy for us to agree to and nod our heads today while we're in this webinar. But we all know, if you've ever experienced when you've been face to face with a patient or a patient situation in which perhaps your ethics are challenged, or it's a culture you don't understand, or maybe there's a language barrier, that extending compassion can be more challenging in those moments. So I chose the CNA definition because the Canadian Nurses Association, they are a very respected organization, and they also write literature with the context of the entire nursing team, RNs, LPN, registered psychiatric nurses, and so that's one of the reasons why I chose this definition. Other literature refers to compassion as empathetic concern. It involves trying to understand another in their suffering and distress. And so it's reaching beyond just what you observe and what you see to actually trying to put yourself in that person's current state, and then again, going beyond and trying to help them. Ultimately, compassionate does require genuine concern, And so this is where you can't just fake it or, show up to work. It's where you have to literally walk the walk and talk the talk. And I believe this is true, even if you're working in a situation where pain may not be completely alleviated, or perhaps cure is no longer the goal. Total healing may not occur, and everyone on the team and the patient and the family realizes that, but there's still that dire need for compassion. Because regardless of the outcome, compassion does create a more bearable situation. Calmness and kindness. If you think about when you've worked and you have been in a situation that maybe was traumatic or extremely sad, if there was calmness and kindness versus someone that was very stressed and expressing their stress, there is a marked difference in what type of nursing care is given. In some situations, overt compassionate care may be acute or short-lived. So if you're thinking of the OR nurse, the recovery room nursing care team, when you're thinking of labor and delivery or the emergency department, in those instances, compassion may be very short-lived. But then if we swing the pendulum, in other situations, it may be prolonged for days, weeks, or even months. And when I was preparing this presentation today, I immediately thought of the ocean and the ebb and the flow of the waves when the tide is coming in or the tide is going out. The need for compassion, that increased sensitivity and warmth and kindness, when you're in those situations where care is long-term, that need for compassion may wax and wane. There may be shifts in which you need to provide more compassion, and then others in which the person is having a good day and it may be minimal. Compassionate communication. Again, I allude to the code of ethics with the CNA, because communication is the heart of relationships, both on the job and off the job. And this does include both that verbal and nonverbal behavior. For example, active listening, appropriate tone of voice, and facial expressions. I know that's something that you'll read in the literature that people are saying they're finding it more difficult with the mask. So our eyes, our facial expressions, the window to the soul are the eyes of the human. And it's those small moments, like you can see captured in this photo, that we need to keep in mind that there will be times we may need to stop the task, even for brief seconds, or if you can, if depending on the situation, afford the time, it may be minutes, to actually make eye contact and extend that sense of, I am listening to you. It can be also as simple as matching the tone of your voice to the situation. So for example, if you're in labor and delivery where there's new life being born, it may be a joyous situation, but at the same time, it may be a situation where there's someone receiving a diagnosis that is going to be very difficult to accept, or it may be someone transitioning from, living to the afterlife. Depending on the situation, matching our communication, verbal and nonverbal, to the situation is going to be so crucial, and it is crucial. So in addition to body language, I wanted to just touch on therapeutic touch, because it is such an appropriate thing. I know that with the passing of time and with lawsuits about sexual misconduct and things of that, I feel like sometimes therapeutic touch isn't really touched on or talked about as much, but there is a place for appropriate touch. And the thing about appropriate touch is that it can cross multi-generational differences. It can speak any language. It can be used to reassure or comfort. Maybe there's a moment when there are no words, but an appropriate touch to the arm or the hand or the covered foot at the foot of the bed. It may be what offers comfort or reassures the person. It also may be a link to encouraging trust in the nursing therapeutic client relationship. I remember one situation in which I was working in an adult intensive care unit in the state of Maine, and I was at a loss, and the only thing that came to me was to reach out and to touch the foot of the gentleman. It was covered with a sheet, and just to reach out and touch. And while I was talking to the family, to touch the patient. I want to allude to the fact I have a picture here of a nursing care professional speaking to a woman, and that I'm trying to show nursing administration or nursing education. And to those who are listening today, that you may be in a formal nursing leadership role, or perhaps you're an educator, sometimes the face-to-face conversation with colleagues, employees, or students needs to be taking place instead of always electronic communication. And that's to foster and maintain that human aspect of the collegial relationships that are so important. Eye-to-eye conversations do foster feelings of being heard and understood. Research shows that it does release that feel-good hormone, dopamine. And more importantly than that, I think for me, is to remind us that when we do a face-to-face or a virtual face-to-face, we are removing the potential risk of unintended messaging that can be received through electronic communication. Several times I've been involved in a situation in which a message was received that wasn't intended, and it was because it was sent through an email instead of a face-to-face. So the practice environment, lots of airtime around the practice environment in nursing, especially I find in the nursing week this week in the media with the pandemic. We know that the practice environment is not at its best, but I believe that compassion, and we need to be, I think, even more cognizant of the need for compassion with each other and with our patients and their families during these trying times. Leadership and collaboration will impact the workplace culture. And I read something in the literature that really I wanted to share today. Compassionate leaders create compassionate organizations. Compassionate organizations will improve staff morale and therefore improve the care delivery to patients. So compassion can be modeled from nursing administration, managers, all the way down to the nursing care team and that frontline patient and their family. The more authentic and caring the leaders in our profession, the more caring and genuine the nursing team will be as a whole. And so you may ask, well, how? Give me some examples, Susanne. Well, I'm going to dig from the literature. I'm not going to make it up out of my head. The literature shows that an ideal management approach models positive and professional attitudes. So even when the going is tough, that attitude, the positive attitude. Another thing is recognizing hard work and dedication, giving praise where it is due, fostering an environment where employees feel safe to bring up concerns, that they're not just going to be poo-pooed or labeled as the whiner or complainer, but that they're going to be taken seriously. And also acknowledging the impact of negative stressors impacting nurses and today and the other healthcare team members. An example of that is being short-staffed or these visitor restrictions during the pandemic. Having leadership that acknowledges, you know what, we recognize this is difficult and we are here for you. We are standing behind you. And so secondly, you may ask, well, why? Why, Susanne, should this be at the forefront of our mind? And it is because the literature shows that when the nursing environment is consistently overwhelming because of heavy workloads and short staffing, the literature does show that there is increased negativity in the workplace. There is a dip in professionalism, and therefore there is lower quality nursing care that can take place. The opposite is also shown, that when there's a positive leadership team, when there's a positive work culture, it does trickle down to create a more positive environment and therefore better care for the patients and their families. On a side note, I know that I have experienced that when someone is positive towards me, like a nurse manager, it instills me the want to do better, to do my job as best as I can. So I want to take a few moments to talk about compassion fatigue and burnout syndrome. If you are comfortable, because I know people sometimes do this together in groups, or maybe you're just not comfortable even closing your eyes when you're alone in your office. But if you feel comfortable enough, I invite you to close your eyes while I read the following paragraph. You are a caring professional and possibly a perfectionist. You stress over the one thing you did wrong, and you brush off the importance of all the things you did right or that you did well. You are known to be bright. You are known to be a go-getter and a valued team member that is collaborative. Over time, you wake up and you feel nothingness. You feel fatigue to the point that you are exhausted and struggle to care for anyone, including yourself, your loved ones, and your colleagues at work, and your patients. You can open your eyes now if you had them closed. That is a description of someone who could be experiencing compassion fatigue or borderline burnout syndrome. Compassion fatigue and, in some cases, burnout are impacting healthcare professionals at an alarming rate. I reviewed some of the literature from the United States, and it was really heart-wrenching. Some 4% to upwards of, I think it was 14 and 15% of places where there's burnout, to the point of healthcare professionals taking their own life. It is a time where we need to talk about compassion fatigue and burnout syndrome. It doesn't make us weak. The literature shows that the groups of healthcare professionals who are at a higher risk are those who are new to healthcare. So the LPN or the RN who's new to the profession, those working in critical care areas, and those working in areas where there's high rates of death or trauma. These are the groups that are even at a greater risk of compassion fatigue. I wanted to stress today that compassion fatigue and burnout are not synonymous. They are not a synonym and should not be used interchangeably. Compassion fatigue can lead to burnout, but they are not exactly the same. So we're going to look at the screen here together. But before I do, I just thought it would be neat for you to share with you that the term compassion fatigue was coined in 1992 by a nurse named Carla Joinson, and she noticed that nurses who were coping with heartache on a frequent basis were losing their ability to nurture patients like they used to. And so that's how the term compassion fatigue was coined. She described it as a disorder affecting those who do their work well, and it is sometimes called the cost of caring too much. And the ironic state, or the ironic aspect of compassion fatigue, is that it is negatively impacting nurses for the very reason that they came into nursing. And for us, many of us, we were called into the profession or chose the profession because we wanted to make a difference, we wanted to care, we wanted to provide safe, competent, and ethical care to those who needed it. And so I wanted to just take a moment to look at the difference between the two, but also the similarities. So compassion fatigue is described as that emotional exhaustion for caring. Secondary traumatization is not, for those of you that aren't familiar with it, you aren't experiencing the trauma, but you're watching or you're taking part in the care of someone who is experiencing trauma. Maybe it's emotional trauma or physical trauma or both. Compassion fatigue can have a sudden onset, and a lot of people do not realize that. They think that it's a gradual thing. Yes, it can be gradual, but it can also have a sudden onset. So you can be coping really well, feeling like you're doing great, and then just within a very short period of time, you're feeling that exhaustion And I'm going to share some other symptoms coming up. One thing that was shown as a contributing factor, and I thought it was important to bring up today, is that advancing scope of practice, because as nursing care professionals, our scope of practice is changing and advancing, broadening year by year, and that is one of the contributing factors. And so when you stop and think about the teenager that's wanting more privileges, quite often the parent will say to them, well, with more privileges comes greater responsibility and accountability. I think the same is true for as our scope of practice broadens, we do have more responsibility and more accountability. As we do more, we are responsible for more. Other contributing factors that were commonly seen over and over again in the literature are inadequate staffing, that very high patient acuity that we're seeing now, and then also the challenges to the team, challenges to leadership, and again, right now, challenges related to the pandemic. Burnout syndrome is that prolonged psychological response to job-related stressors and personal stressors. So not just the workplace, but also your personal life. It occurs when work demands exceed one's ability to cope. So if you think of an old-fashioned scale, and on one side you have the demands on your life, both professionally and personally, and then on the other side of the scale, you have your coping mechanisms. Burnout syndrome is when that demand, what's being asked of you or required of you, is greater than your ability to cope. And burnout syndrome is characterized by emotional exhaustion, depersonalization to the point that you're literally detaching yourself from humans and from things that you enjoy to, previously enjoyed doing. And it's also that decreased sense of accomplishment, that joie de vivre, or the passion that you used to feel for nursing, it's no longer there. So on the slide, I hope you're able to see it well today. On the right-hand side is listed some of the signs and symptoms of compassion fatigue. Overarching symptoms, so if you look at these are the individual ones, but overarching symptoms may lead to decreased self-confidence, as I said earlier, withdrawal or detachment from patient involvement, your colleagues, that sense of job dissatisfaction, and in extreme cases, leaving the profession altogether. And that is happening. There are studies, even in New Brunswick, there was one done, I know, a few years back with professors from Université de Moncton regarding nurses who are leaving the profession. Nurse researcher Michelle Perengrini, she listed 3 categories of symptoms. So she looked at these, the ones that I have here on the screen, but she put them into 3 different categories: job dissatisfaction, declining health, so that could be declining physical health or declining mental health, and then that feeling of hopelessness. Some examples of how they may be displayed, some of these symptoms would be, and you're probably going to be able to say, yes, I have witnessed this, or maybe I've experienced this: excessive complaining or blaming, difficulty concentrating on what you're required to do or what you're supposed to be doing, calling in frequently to work for sick calls. In extreme cases, the quality of nursing care may be decreased. So you could have someone that always provided amazing, excellent nursing care, and now you're starting to see that their quality of care is just meeting the mark. It's not going above and beyond like they used to. Also, that diminished ability to collaborate with the team. Again, just kind of withdrawing and doing the lone soldier type of work. And then in worst case scenarios, a lack of genuine concern for patients and colleagues. The first step, I believe, and I want to turn to a little more positive because I don't want to depress us all and then leave you all feeling super negative on LPN Day 2021. What can we do about it? How can we start to address this? And I came up with the little the phrase that I use, name it and claim it. The first step is to acknowledge that you are experiencing some of these symptoms of compassion fatigue or burnout, that, you know what, I am at risk. Acknowledging that, because once you start to identify these symptoms, then you can start to self-reflect on, okay, why is this happening? I call that self-compassion, and we're going to talk about that in the next slide. But once you truthfully admit that you are at risk of compassion fatigue and that you actually have some symptoms, then you can start to do something about it. And you can start to acknowledge the negatives. You can also, and I suggest that you do, I have to do this, what is within my control and what's outside of my control. If it's within my control, then what can I do about it? But if it's it's outside my locus of control, like short staffing, right? I can't fix that. We can't just create nurses overnight. So what can I do to better cope with my new workplace reality? What safeguards can I put in place to ensure that I'm at my best psychologically, mentally, physically to go to work and face and cope with my new workplace reality? So what are some strategies to prevent compassion fatigue? From the literature, there are common themes for preventing compassion fatigue, and I'm going to list some of them here on the screen. It was noted repeatedly that because we are individual nursing professionals, so the literature, and I've said this, and Cathy have said this in our professionalism series, that we are to look at the patients as unique individuals. Well, we also need to remember that we are individual nurses. We perceive events and respond to events uniquely. So what I perceive as a stressor, you might not perceive as a stressor, or how I react in a high stress situation could be very different in how my colleague reacts. And so we need to remember that how we react can look very differently, but it can be just as serious. So stop comparing yourself to how you think your colleagues are doing, because they might not be showing stress the same way you are, but they could be equally stressed. So I'm going to just look at some of the suggestions here. Self-reflection at the end of each shift. Some people like to write. Some people hate journaling. Again, what works for you? For me, as you can tell, I love to talk. And so quite often after a stressful shift, I will find myself talking to myself while I'm driving home, or replaying things in my mind and just walking through it, either verbally to myself in my vehicle or in my mind. Debriefing as a healthcare team. Even if you feel like the rest of the team doesn't need it, maybe they do. If there has been a traumatic event that's happened in the workplace, the healthcare team should debrief as needed. Huddles at work. I know that there are some units in the hospital where I work that huddle on a regular basis, and it makes a difference. Each shift regarding the daily stressors, that needs to be talked about. Who needs help? Who's running behind? Who's feeling like they're sinking? Huddles can be a good way to address those feelings of helplessness during a shift. Intentionality to drinking water and taking breaks with nourishment. How many times do we as nursing care professionals go without drinking properly, hydrating ourselves, and taking a proper nutrition break to refuel? And then the self-care, physically, emotionally, and spiritually. I place the icon of the person struggling to move the gas gauge from the empty position to the quarter tank. And there's a reason for that. We need to refuel with self-compassion. Pause and think right now with me. What makes you feel at peace? When you're in your happy place, where is that? What are you doing? Who are you with? Are you journaling? Are you in nature? Are you spiritually inclined? You believe in God, and so it's when you're at, doing a devotional or going to church? Is it when you're with family or close friends? Whatever that might be, today you deserve to pull into the gas station of compassion. So not the Irving, not the Esso, but what Suzanne's calling the gas station called compassion. Fill up your soul tank. Do that on a regular basis. Treat yourself with kindness. It can be free, or it could be something like a manicure or a pedicure. But what is it that's going to fill you up to help you be a better LPN, be a better registered nurse? Don't use avoidance. I think many of us are very good at trying to shove things under the rug, and we really need to stop doing that, because it will come out at the end. It will, research shows, rear its ugly head in the form of stress, compassion fatigue, or maybe even burnout. This is where teamwork and support can be so crucial. Those shifts in which we're working together, we can support each other in compassionate care. We can stop the domino effect of compassion fatigue and burnout together. The literature says that, or you'll hear people say as well, fear is contagious. I say courage and compassion are also contagious. So if you take away something today, take away this: self-compassion, but also that courage and compassion are contagious. Amidst the high demands of healthcare, what might happen if we refocus the stressors in nursing, such as the job shortage, the high acuity of the patients? If we shift our lens away from, oh my goodness, I'm abandoning my nursing values, I'm not able to do what I know I need to do, what if we focus less on that negative lens and switch it to, okay, I'm going to work together. I have this care team working together. What is within our control? What can we do? How can we recalibrate our expectations of nursing care and view the team as a can-do team, that we're going to accomplish the tasks and provide the care that we need to do? How do we need to learn to reprioritize patient care needs in the clinical setting? Do we? As administrators or nursing educators, do you need to do things differently than you used to a year ago or 2 years ago to get the job done? I don't have all the answers today, but I do know that collaboration must happen. And in the units that I visit with the OnTrack and Horizon Health Network, the units who are collaborating together, they are doing well. They are doing good nursing care provision, and you will hear laughter on the unit. We can start by encouraging each other to stay focused on why we chose nursing. Why did we choose this amazing profession, nursing? It was, I would say, to provide safe, compassionate, and ethical care. Ask for support on the job and offer support. Do not walk the nursing road alone, because you know what? As humans, we are hardwired to share life together, and that includes our workplace. So today I'm ending with a call to compassion, a call for compassion. A culture of caring is a culture of curing, and compassion is not that optional extra that some people might think is the icing on the cake. People, both the patients and the employees, the nursing care providers, we are more important than key performance indicators or dollar signs and budgets. Are dollar signs and budgets important? You bet. Are key performance indicators and standard indicators important? You bet. But the human patient, the human healthcare provider is more important. It is easy for us to get caught up in viewing nursing as that task list that we got to perform. Who's doing what? And yes, that's important. I would be a fool to say that's not important. It is important. But I want to just caution us once again that if we are only viewing our role as nursing care providers as a task list, then we are at risk of losing that compassion. If we don't use it, we are at a risk of losing it. Research shows that RNs and LPNs who are perceived as available by patients and their families are considered as more competent, more trustworthy, and more compassionate. I would like to take that a step further today, I think partially because I work in nursing administration, to say that employers and managers and those of us who have a formal nursing leadership position, if we too are perceived as available to those who work with us, I believe that the nursing professionals will feel more supported and more positive about the workplace. I really do. I've seen it. So some of the key points I want to end with today, and I hope that this will give you some inspiration to keep on doing the amazing job that you are, that nursing professionals, we do have the privilege of sharing some of the most vulnerable moments and experience with humans. That competent, compassionate, and ethical care does include effective communication, and these are essential elements that are needed in all domains of nursing, from student to healthcare worker in the front lines to those that are in research and administration. Compassion and competence are essential. Attributes of compassion the attributes do include trust, empathy, sensitivity, dignity, and respect. Daily nursing work should be guided by observing closely, looking, acknowledging the medical needs, the physical needs, but also the emotional needs of the patients, and responding as competently and compassionately as we can. And task-based care can become impersonal. It really can. It can become so objectified that we miss the human in front of us, or we miss the colleague beside us that might need a smile or a thumbs up. And you are not alone. If you are one of those persons who is experiencing compassion fatigue or burnout, you are not alone. Reach out, ask for help. I read this, and when I read it, I was like, it was about a month ago that I read this. I thought, I want to close with this. Nursing with purpose. Strengthen me to see the wonder of my work through the eyes of those I serve. Enable me to serve others with respect, compassion, courage, and love. Let my work be a light to those in need and a beacon of hope for those who despair. Thank you so much. Happy LPN Day. Thank you for the compassion and courage you put into your work every day. And I really count it a privilege to share this moment with you. And I'm going to turn it back to Cathy.
Perfect. Thank you, Susanne. That was an excellent presentation. I'm sure everybody will agree. So we are going to have a few minutes for some Q&A, but I am just going to take a quick moment to do a little shameless plug here to show you where, if you were on our first webinar, we did showcase kind of a sneak peek of some new products that are going to be becoming available with our new logo. So we do have some sweatshirts that we're ordering that are bilingual, of course, LPN or EAA, that has our new logo. So they're not available for purchase yet, but we are just testing out some of the products and they will be available soon. So we'll be sure to share it with you if you're looking for some updated logo merchandise. We also are getting some tote bags as well. So this is a gray one with our new logo. And we also have a cream colored one as well. So these will be available for purchase soon, and we'll have some mugs coming as well. So lots of fun things coming. So I just thought I'd give you all a kind of a sneak peek today on LPN Day. So if you do have any questions or comments, you do have the Q&A box on your screen there that you can type your comments or questions in, and Susanne, I guess, will be the best one to maybe answer some of these questions. There is one there now, and of course, if you don't want